we will be recording this, and then it will be on selfmanagementcolorado.org for you to download. So here's the agenda for today. And of course, we have time for additional things if we need to. But knowing it's a holiday weekend, we're going to keep moving through stuff. So first thing, just some brief updates for those of you who are new. And it's very exciting to have some new people like Becky on the call. And Ellen, this is Ellen's second time on the call, I believe. So we spend a lot of time discussing what's happening with some of the current funding that we have, in particular our grant with the AOA through the Department of Human Services State Unit on Aging. But the intention of the collaborative has always been to look for what else we can do, best practices, making sure that we're sharing everything we can, sort of making the most of all we have to offer. And so although we focus sometimes on the funding and the grant things, please keep in mind that we really want this to be about all of us being able to sustain classes, embed them in systems, do more classes, and have more of an effect on the people in our communities. So with that, we'll move through our agenda, maybe. Okay, there we go. So regular collaborative, we already did that. So Connie, I know it doesn't sound like Lindsay is on the call with us today. So I'm going to turn it over to you because I know you had some things you wanted to talk about from year 2 of the AOA grant and year 3. And then I do have loaded in here on a couple of slides the information that you sent me yesterday. So I'm going to turn it over to you.
Hey guys, this is Lindsay. Just wanted to jump on real quick. I had trouble getting on, but I'm here, so hello.
I wanted to pass on a little bit of information. We had our annual grant review conference call with our funding source for the grant, which is the Administration on Aging / Administration for Community Living. They mentioned a couple things, had a couple questions. One is that, overall it was positive, and but they had some good questions. They mentioned that the retention completer rate is something that's being tracked nationally in terms of Congress and how all the states are doing, and that nationally the completer rate is 74%, which is really good. Ours is 70%, which seems really good as well, but they actually mentioned that it was below the national average, and so they're asking about that, and they made one of the people on the call made a suggestion that some of the states have found that getting incentives for participants to complete the series is one way of keeping people coming throughout the class, and that they've gotten donations from local area businesses for, whatever, gift cards or whatever kind of item that the business can provide. So I wanted to mention that and just see if anybody had any comments or other suggestions on that that might be helpful to other people who are on the call or who will be listening to this later. Anybody have any ideas of things that you've used to keep people coming back?
Connie?
Yes.
Hi, this is Monica.
Hey, Monica.
Hi. And what we've done is we have given out like ID bracelets, that type of thing, or which so many people don't wear them, and so we found that works really good. We also have like the diabetes packs that we've given out also, which is a big plus also. So incentives like that we have worked with, something that they can truly use has really been a plus for us.
Okay, great. You mean ID bracelets that identify a condition that the person
They're
might have?
medical bracelets or IDs of some sort.
Mm-hmm. Okay.
We've done that, and you know, we give out logbooks and that kind of stuff for them to keep track of their readings or their blood sugars and stuff. And we do that kind of as we go through so that they know that they're not just coming to the class, but they're really getting something they can use.
Okay, great.
Yeah.
I know a lot of the programs do even door prizes weekly, so that you have to be there in order to get a draw. And the door prizes are things like bags of fruit or fresh vegetables or something like that. We've had also folks have been getting gift cards donated, and so they'll have at the end of the class, the more, again with tickets, the more of the classes you've attended, the more chances you have to win, and they'll do a gift card for King Soopers or Whole Foods or something like that as well. So we've had that. We've also had incentives around rides in the city, either cab vouchers or bus vouchers, or working with volunteer organizations to get rides set up. So we've had those kind of incentives as well.
Okay, great. Anyone else?
I'll mention too, because this ended up being pretty successful. This is Mary Pat from COA. In a situation where they actually, each participant put in $20 at the beginning, and if they attended 4 or more, they got their $20 back. And it was pretty interesting to see how motivated they were to actually get that $20 back. And so that ended up being very successful. We actually had a very high attendance rate in that class.
Yeah. So was that like seen as a class registration fee that if they would get back?
Correct.
Okay.
Correct. We did actually make it optional, though, but surprisingly, everyone did it. And at the end, in one class at the end, because they felt they had such a good experience, they actually donated the money towards the scholarship to others as needed. So it kind of was a win-win in the end. And, you know, we were prepared, of course, to give them back their $20. And they said, you know, I didn't realize how much I would actually get out of this class or enjoy it, so why don't you take the money? And so that was kind of cool.
Yeah, that is. Okay, great. Well, thank you for those ideas, and hopefully others can maybe make use of some of those. You know, some people can afford to buy them, but you know, getting donations from local companies, you know, sometimes they're the marketing items that have the corporate logo in that, so it's a plus in terms of publicity for the local business. So anyway, I wanted to pass that on, and then I can mention to AOA that these are some of the things that you all are doing, and that you shared this information with others on our call. So that's helpful. Thank you. The other question they had, they were looking at what we said we were doing and what the data show that we are doing. And for the past, since August of last year, we haven't reported any of the, quote, positive self-management classes for HIV and AIDS. And I think those were just being done in one location, whether, I think it was either Greeley or Fort Collins, if I'm correct.
Actually, no, COA's this is Lindsay, sorry. The positive self-management classes, we have gotten a license, and I believe right now we were the only license holder that in the state for the program. And the plan was to do this with funding from CDPHE, their HIV/AIDS program. And that conversation was going on as the original grant was being submitted, and we had thought that funding was in place, and then their funding was cut, and so our funding was cut, and so we weren't able to move forward. So we have the license, but we've never been able to cross-train leaders or master trainers or actually get the program going. So that's kind of where we are.
Okay. And I'm sorry, Lindsay, did you say that the funding was cut because the grant was cut back, or?
This was CDPHE. Okay, Mary Pat, help me out. Do you remember the name of the program?
I don't. The one that we were partnering with?
Yeah, it was through CDPHE, and it was their HIV/AIDS program that received funding through Ryan White Foundation as well as other places. And we had intended to put the classes into their statewide clinics, which are connected with community health centers. So it would have been Pueblo, Fort Collins, Greeley, and let me see, where else?
Boulder, was it?
Boulder, yeah, and on the
Grand
western
Junction, I
slope.
think.
Grand Junction, yeah, and I think somewhere south too. But then the state HIV/AIDS program was going to handle Metro Denver with their own curriculum, but that was their funding didn't come through, and so plans were put on hold.
So the foundation funding didn't come through?
CDPHE's funding, and they got some Ryan White funding, but they didn't get all of the funding they were planning on. So they decided not to move forward with the classes.
So there were two sources of funding, and one or the other. Okay. Do you? Is there a possibility you could do some of those classes through the grant?
I don't think so. What we would need to do is cross-train. We have nobody trained. So what we had done was set up a proposal for them to recruit cross-train leaders. The leaders have to be HIV positive, and we were working with them and with their clinics to identify folks that we could train as leaders and cross-train. And so there would be probably a good 6 to 9 months of startup time in order to work with the local agencies and then train. It was planned as a 2-year project and coincided with the grant, with this grant. So we were, hoping to kind of leverage both. But so I can send you that initial proposal if you want, Connie, but I think that there were a lot of pieces to getting the program really working.
Do you have master trainers who could train leaders, or do we not have that?
No. We would have to have, and that was part of what the funding was for, was to cross-train master trainers, to train initially, to cross-train several of COA leaders and master trainers, and then as we were working across the state to identify HIV positive folks, which is the intention of the program, that it be run with HIV positive leaders. So.
Okay. Well, maybe it's something we could talk about for year 3, because there is some scholarship money in the initial budget that I submitted for both master trainers and leaders. We could see if there's a possibility of doing that. I would think in the Denver metro area it wouldn't be too hard to find HIV positive people who'd want to do that. So Colorado AIDS Project would be one place to look at. But anyway, would that be all right if we talk about that?
Yeah, can we talk about it offline, because there were a lot of
yeah, that's what I just said.
Yeah. Okay.
Yeah, because I know we need to move on. Okay, that would be great. It would be nice to be able to explore that, which is kind of related to the next topic, which is different populations that I wanted to ask you all about. I was on a conference call with the other states that are doing outreach and classes too in the prison system, and NCOA mentioned that that's a population that they are interested in having people work with, and that since they're a captive audience, so you tend to have very high retention rates. So they mentioned 3 different models for doing class, for identifying and training class leaders, which are indicated here on this slide, which is community-based leaders as you currently do. In some states, they have people going in to the prisons and running the classes just as they normally do, and they, have different ways of addressing the security issues. But anyway, that's one option. And then another was they use some prison staff. So those folks are already used to working in that environment. And then the third is using prison inmates as the lead leaders. And I wanted to just ask you all about your level of interest in doing something like that. We certainly have prisons all over the state, and it's something that we could start initiating here at the state level to work with Department of Corrections to maybe identify a pilot program somewhere. I thought about in terms of COA with the embedding that you all do. This would be a great opportunity if they're using prison staff or inmates where it could be embedded, and they, would ideally keep the program going without grant funding over time, I would think. So I just wanted to ask people about the level of interest, what questions you would have at this point, and whether we can maybe identify some people to look at some kind of a pilot project.
Connie, this is Holly in Wells County. Since we're specific with the AAA and 60 plus, I don't think that would be something that we could branch out into. But
okay, yeah.
I might have a contact at the Sheriff's Department that I could see if they're interested in hearing a proposal from you, and if they are, fine, you guys could take it from there, and if not, then.
So would that be people in jail? That'd be probably more people who are shorter term in jail, though, wouldn't it? Versus prison, where they're there for quite a while, typically.
Right. Yeah. No, it's not a prison; it's a jail.
Yeah.
I'm sure some of them are in there for longer than 6 weeks. But.
Yeah. Well, I'll keep that in mind. And I did ask that question about to NCOA about the populations, because typically the prison population doesn't, well, a lot of people don't fit into the typical grant categories of 60 plus with a chronic condition or adults with disabilities, maybe more so with adults with disabilities. But the person I talked to at NCOA said that the Administration on Aging has generally been supportive of working in prisons, irrespective of the grant criteria. So I know that you have different marching orders and mission as the AAA, but for other people, that's an FYI.
Also, Connie, this is Mary Pat. I'm just thinking about Canyon City, and I know we had worked with St. Thomas More Hospital with leaders trained down there. They were, of course, just reaching out to their older adult community primarily. But I know, I understand anyway recently that maybe Secahek trains some other leaders in Canyon City area. Maybe that's something they might be interested in, already having some leaders in that area.
Mm-hmm.
That's just a thought. Are they on the phone at all?
I am. Can you hear me?
Yes.
Okay, I wasn't sure if you were going to be able to hear me. This is Eve at Secahek.
Is that maybe something you guys might want to do?
Well, I'm sitting here thinking about this because although I did not work at the Department of Corrections, I did work at them. I retired. Excuse me. I retired at the from the Colorado Mental Health Institute, so I did work with inmates who are placed there for short periods of time, so I'm familiar with the population. And one of the other, Shanae Gutierrez, who is one of our other program people, and I did a program there when we were trained with the Asthma Toolkit program, one of our other projects that we did. And so we have gone into the prison system. I'm somewhat familiar with the process. It would not be something that would be foreign to me, getting it, trying to get into that population. And I'm trying to think, the Canyon City, Crystal is not on the call this morning because she's out for just a little bit this morning. But we did have some people from Canyon trained. I can't remember if it was 1 or 2 people, but that's something to discuss further.
Okay.
Because it doesn't, I mean, I'm familiar in working with that population. I think it could be done. It's a matter of communicating with, we just have to figure out who the contact people should be, because, you know, you're looking at security and so on and so forth and getting in, and it's a state system, so it can be a little bit complicated. And I don't know who you would communicate with to get in, but I know some people that could probably guide me.
Okay.
To do that. So I think it's worth discussing further.
Well, that's certainly the largest population. There's so many different facilities there. So I appreciate that. Many facilities.
Yes,
there are. Mm-hmm.
So
okay,
I mean,
that's great.
So we can keep, I think we should talk about that further, and you know, once the other two, my 2 other people are here, we can talk about it. And having worked with that population, I know you know, the health for some of these people. I mean, they would really be able to use it. I think it would be of great benefit.
Yeah, and I think so much of prison life is not really empowerment. You know, you're being controlled, and you know, for lots of good reasons. But this is can be and has been for some of the other states a real positive impact on the people that have been reached through that. And
right.
Of course, if you know, to the extent that they're having inmates lead classes, which may or may not be something that they'd want to do, or you know, that would end up happening, but that's certainly
well, and you know,
empowering.
It can be extremely empowering, and it would be, I guess, as a nurse, I think in terms of how you help others become more responsible for their health status, and once they do that, I mean, it would be extremely productive to work with some of the individuals that would be able to lead the classes there. I think it could be done. I don't think there would be, I personally don't feel like it would be a huge problem. It's a matter of one of the issues I, right off the top of my head, would think about is they have to meet certain criteria to reach a certain level of security, and then depending on their behaviors, if it didn't meet the standard, they would be pulled from it. So it would be a privilege for them, I think. Yeah. So, but anyway, I mean, it's worth talking about, I think.
Yeah. Okay, and you're hitting on some of the issues that were discussed on the call, where people are talking about, you know, screening people for the classes, and having one of the states had, at least one had inmates on the screening panel, so it was another way of kind of empowering them, and you know, taking advantage of the information they have about their co-inmates and their appropriateness for the class and that. So, okay, Evo, that's great. Did anybody else have anything else to say about that?
Hi, this is Glenda Mitchell. Can you hear me?
Yes.
Okay.
Hi, Glenda.
Yes, hi, with the Center for African American Health. And just to say something about an experience we've had, but it was with our diabetes prevention program at the Department of Corrections. Now, since we use volunteers, perhaps you've had an experience that they do require a full background check for anyone that would be providing classes at their site. And that was a local site here in Denver. So we would possibly be interested in working with the prison population, but it would need to be local, and as you said, it would need to be where they're there for a longer enough term to complete the class.
Yeah, okay.
So what had that come up as far as those kinds of requirements?
I don't remember if anybody mentioned the background checks, but you know, that certainly is that certainly makes sense to me. So yeah, that's great, Glenda, that you might be interested in that as well. So I'm noting that, and it seems like probably since I'm at the state level, it would be good to broach that subject with Department of Corrections and then let them know of the 2 locations that might be interested and see what, where we go from there. So certainly not obligating you by expressing an interest, but it's something we can pursue and see how, where we go from here.
In our situation, we were actually just working with the prison staff at for that particular program, but I don't know how it expanded. We'll consider.
Yeah, and I don't. Hopefully, it would be a dialogue about what they would want and what we could do. And sure, some people are more comfortable working in that environment than others, but like I said, it just seemed like a very positive experience. It would open up a new population, and have a pretty good chance of, reaching people and having them complete the classes and that. So,
this is Eve again. I'm thinking that here in Pueblo we have some facilities, and one of them is the San Carlos facility that initially was built for those prison inmates that had chronic mental illness. However, there are other individuals that are there that don't necessarily have a chronic mental illness. But having gone in there to do our other program, we did work with the staff, and they have nursing staff there. And not that you need to even have the nursing staff background. There might be people that would be interested in just becoming trained so that they can end up teaching the inmates on an ongoing basis. So, I mean, there's a lot of issues I think that would come up, but I think we should have the conversation with some of the state leadership because there will probably be a lot of issues that come up that we're not thinking about.
Sure. Now that's a great idea, and I have that in the next bullet item, but the behavioral health, people with behavioral health issues, and certainly, there's so much of what the class focuses on has a good potential to impact people's, emotional state. So I would think that could be a real plus for them. So yeah, thanks for mentioning that.
So it sounds like that's one that we need to follow up on
right
at your level, Connie, and then maybe talk about again on the next call or have another offline conversation about.
Right. Yes. So the next bullet there about working with individuals, as I just mentioned, with behavioral mental health issues, hearing impaired, physical disabilities, those are populations that I can help with doing some outreach to, because so many of them are served by our agency here at Department of Human Services. And I just wanted to mention that I don't hear a lot on these calls about working with folks in these from these populations. Maybe you all are doing that already, but I just wanted to ask you about that and see if there's any comments, questions, concerns about doing outreach. The hearing impaired population, for example, and I know some of the people who work in that section, and I know they hire interpreters for different things. Whether they could hire them for classes with their funding, I don't know. But like I said, just wanted to ask you if there are any issues or questions or concerns you would have about trying to do more outreach at local or state levels to reach those folks.
Well, I know we have a couple of our organizations we work with that are doing programs specifically for behavioral and mental health issues. That's why they've trained leaders. That's why they're doing the programs. And so we've had some good experiences there. We've also had some challenging experiences just because retention tends to be an issue. In terms of physical disabilities and hearing impaired, we've done several classes now. What are we at? 4 classes now, Mary Pat, with the folks at Colorado Access and Goodwill, or not Colorado Access.
Are you thinking Advocacy Denver?
Advocacy Denver, thank you very much. I've been on vacation. Advocacy Denver, which are folks with developmental and intellectual disabilities, many of whom are also hearing impaired or deaf, and so we've worked some with their classes, which has included work with some other agencies that have referred folks in, including Goodwill, who hosted a class. And in that situation, they were great classes. Very good retention. They were interesting classes too, because in addition to needing to paraphrase so that the content was clear, we also had multiple interpreters working with folks at any given moment. So the class I did, I think we had 7 interpreters in the room at one point. So that's what I have to say about that. Mary Pat, did you want to add anything about some of the work you've done in that area?
Sure. Yeah, on the Advocacy Denver County, just as an FYI, we submitted their clients last year, but this year they really were ready to do a class in the fall, so it didn't fall into our funding period. That was the downside, but it was a huge class that we were able to have. We had probably 14 to 15 folks in that class, but you aren't seeing it because it was in the fall. We were hoping it would fall into it. And so the efforts are there. We contacted them to do a spring or summer class, and after all was said and done, they just didn't feel ready to do another class probably till the fall again. So what's happening is we're working with them, but it's not falling in the grant cycles.
Okay.
And then the other one, and that's locally, and those have been really successful classes, and Advocacy has adult day centers all over the Denver area, and so it's really, like you're saying, a captive audience, and we're able to go into those centers and conduct the classes, and so retention and attendance and all that is great. But we're off cycle right now with them. The other thing is Access Health down in Cortez. That's an integrated behavioral health clinic, and that is one of our startup clinics you'll see. So they're very excited, and they're looking to do, they really do want to sustain it. They've now trained 7 leaders, 7 staff are trained. So they're looking at doing it in Cortez and then 2 different clinics in Durango, all with integrated behavioral health clients. So that's more to come on that.
7 leaders. That's impressive.
Yeah, yeah. And is it Southeast? Not Southeast.
Oh, yeah, Southeast Mental. You're right.
Yeah.
Southeast Mental, their classes are going well. They do very small classes.
Where is that?
Southeast Mental, it serves all the southeast section of Colorado. So when we're submitting numbers to Lindsay, it's going to be like the classes in Walsh and Holly and Ordway and those
Lamar, La Junta,
all that southeast area. They're actually going to be the leaders in our Rocky Ford class coming up. So they're doing well, and then Jefferson Center for Mental Health does classes for us under our license, I should say, and they've got probably 4 staff trained, and they've really been sustaining well. They've probably been going since 2011, and they'll average 3 to 4 classes a year. But not always are they over 60. They're younger, and the problem we have is a release of information. They really have to get a written patient release form for us to get demographics on them. So that's something we're trying to figure out how to navigate through. That's something that's come up in the last year, but we'll have to just see how that plays out. They're very it's a very protective, guarded, information of their patients and clients. And so they're happy to do classes, not so happy to share information.
Yeah.
And so that's the piece we're working on.
Yeah.
They're trying to figure out how that could be integrated into what they're doing. If the patient doesn't give permission, we don't get anything, other than they had a class and, you know, there were 6 completers out of it, 10 that attended or something like that. So that's been a little bit of a challenge. I don't know if other folks are have a way to navigate that. That would be great and helpful.
I think it's also the difference between if it's a behavioral health issue or if it becomes a mental health or a serious mental health issue, that there are sort of different levels of concern, and so I think it depends a little bit on which partner we're working with. So Jefferson Center for Mental Health has been the one that with some real issues around that. So that then makes it hard in terms of reporting. We're still able to do the classes, but it makes it hard to then report them under the grant guidelines.
Yeah, I would agree. Access, they're actually, when they make contact for a referral, they're getting written permission right at that point. And then they're able to release information and share it. Jefferson Center, I think, kind of going back through that now as they've tightened up. So I think we'll get there. I think it just restricts it just a little bit. Maybe that recruitment and sharing of information process is a little bit more challenging. That's all.
Okay.
Not insurmountable.
Yeah, I mean, it's just such, like I said, it just seems like this could be so helpful to people with emotional behavioral health issues that
Absolutely.
I would really love to see us reaching more of those folks. Do any of the other folks on the line have any questions or concerns about incorporating folks in any of these areas into their classes?
You know, this is Eve again with SECAHEC. We have the Mental Health Institute here in Pueblo. Maybe that, I don't have any concerns. I think it would be a great population to work with. Maybe what I can do is do some outreach to that facility just to see how receptive the administration would be over there. Many of those patients are there for a very long time, and others are there for very short periods. But I think if we could get some staff trained over there, I think that would be really super. I mean, that's another area that we went into with one of our other projects. So that might be a population that Crystal and Shanae and I can do some outreach to. And again, we'd have to visit with the administration, and because of the security issues at the forensics facility, there are civil patients there, but there's a lot of security over there, and they're pretty protective, and we'd have to fill that out. So, but I think it's a great population to look at.
Okay, well, that's great, Eve. Thank you. Let me know how that, what comes of that if you just if you do that and what kind of reception you get. They're operated by us, so if, we could also support it from this level. But if you can get some interest, with the folks there, and that would be great. So
I imagine, I would hope that they would be receptive. I know that they just lost their superintendent, so I'm not sure if they've rehired, if they've brought somebody else in. They were doing some outreach, so I'll have to. I have some nurse friends that are still working there, so I'll fill it out a little bit.
Okay. You might mention that it's funding comes from the grant from Department of Human Services.
Yes, definitely. Yes.
I mean, because they're
yes, they're part of Human Services.
Yeah, and they might
absolutely
be helpful in sort of putting it in context.
Yeah, my opinion would be based on when I was there about 5 years ago. I retired from there. I would think that they would really be interested in doing that to support the patients there, making them more independent. But things change, so I don't know some of the new people that are there, but I will definitely follow up on that.
Okay. Well, it could be a cost savings, too. I mean, they mentioned that on the conference call with the prison population, that to the extent it's impacting people's health, you know, there may be less lowered cost in some areas, so that's, you know, maybe an incentive for them as well.
Absolutely. Absolutely.
Okay, great. Well, I appreciate that. Let me move on to the next one. I've been talking with some other leaders of CDSMP in other states, and one of them mentioned that they have a grant through a program called AmeriCorps that some of you may be familiar with. It's a federal program. It's administered by the state, so the funding and applications and all that go through the governor's office here. But the way they have used the money is to pay for leaders. You know, it's not called a stipend, it's called a living, quote, living allowance, but which is basically a small amount of money that they get paid for that. And it seems like I wanted to see if you know, were interested and who might be interested in talking further about this, either on the call or individually. The grant cycle, well, anyway, let me explain the grant a little bit more first. The requirement, though, is that, as I have in this bullets here, they need to do more, the members, the AmeriCorps members that would be hired would, in addition to leading classes, need to do something else because they have a minimum requirement of 300 hours per member per year. So this other state has used them for health screenings and blood pressure checks and whatever else that is appropriate and needed at the local level. So it's like upping your workforce without having money. And despite the fact that the dollar amount isn't that high, they have it. They've had good success in getting people to apply for these positions. Sometimes it's people who are retired. Other times it's people who want to go back to school because there is a kind of a scholarship that's awarded based on participation each year. I didn't pull that out before I got on the call, but it's something around $2,000. So you know, sometimes people do it for that reason. But so I wanted to mention that as a possibility and see if you all might be interested in any one particular agency on a statewide basis or individuals locally. We'd have to, you know, go through the grant requirements and see what would be, what would fit. But I just wanted to mention that because as we're looking at sustainability and leader retention and all that, this could be something that would be very beneficial.
This is Lindsay. I actually was in AmeriCorps in between undergrad and grad school. Yeah. So some of the details you said were right, some not as on point. But the point is that, yeah, it's a wonderful, wonderful organization, great opportunity. My one concern is I don't know if they would be lay leaders because, again, I think we really encourage in the CDSMP for the lay leaders to be relevant. And I think a lot of times that's what helps it be successful. The people up there are just like people like me, meaning you're going to this class and this person also has some relevant experience. So depending on the lay leader, the AmeriCorps member you got, I don't know if they would have as much relevance to the people in the class. And again, there's lots and lots that goes into it. So it's pretty in-depth program. So we would have to obviously, there'd be a lot more that they would do and need to do than just lead classes. So it's awesome program, love AmeriCorps, but something you definitely want to do a lot of research on. I don't think it would just be a way to get lay leaders.
No, it is, as I said, something that you'd have to have people doing a lot of different things, but at least one other state and has been doing that and has found that very useful at the local level. I don't know if they use them, well, they do use them for lay leaders. I don't know if they use them for the person who is supposed to have a chronic health condition, but they're the ones, well, I believe they're the ones, the local entities are the ones hiring them, so that could be built into the criteria. They've, but like I said, they're doing it. It's a CDSMP program, so it does, it can work, and they've been successful. The bulk of the work for them has been done at the statewide level. The organization that gets the grant, it is a lot of work for, hiring, doing background checks, fingerprinting, paying people, all that kind of thing, the tracking of the paperwork and reporting. But they found it to be worth it. And for the local levels, because the statewide organization has run the grant, and the local levels basically get the benefit of an extra person or however many extra people. So at the local level, it really hasn't involved that much other than signing off on the timesheets of people, and of course supervising them.
I'm sorry. Isn't there a matching portion? So if you get a grant, you have to match that.
I think it's 25%, and that would be something we would want to look into as far as the requirements. But the other state that is doing that said that they've been able to use some of that in terms of in-kind services that they're providing. So we could look at to what extent.
I have a question. This is Eve. When you talk about leading the classes and performing other services is a little vague. Can anybody elaborate a little bit on that?
Well, it's really defined by the grant application and what you want to do. As I mentioned, that this in this other program, they've used people to help with some of their health screenings. Some of those have been, lay-type individuals who are trained how to do, the basic automatic blood pressure cuff testing and helping with outreach and that kind of thing. So, and in some cases they mentioned one person who was trained as a nurse, so that person was paid at a higher level and could do, things that are more appropriate for a nurse to do. So it's kind of what you define it as, and, we could again look at more of the criteria, but there are different categories under the AmeriCorps grant, but this one is something called health, it's not outreach, but health something core. That impacts health. So
it's called the Health Corps branch.
Okay. So so it's not, there aren't like defined categories that you have to pick from, and we could look more into what would be appropriate for an application. In terms of timelines, what they did in the past was they had people submit a letter of intent or intent to apply. Sometime, I think it was in September, but I don't have the timeline for this year yet. And then the grants themselves are submitted a little bit later, like January or something like that. And then the funding is the federal funding year, which would be October of 2015. But sort of have to know that you want, what you want to do and to submit something. I don't know if we could submit more than one. Would need to talk more to the person or people at the state, at the governor's office, to see what they would suggest. But I wanted to mention it because it seemed like a real plus, real positive possibility for folks that, when you have not enough funds to do what you want to do, and this might be another way of accomplishing that. It seemed like a real positive possibility. So,
do you have any idea at what level, when it says the person would be paid a small amount? I mean, do we have any?
I do. The minimum for $300, it is $4,000 as of last year anyway. I don't know if this changes. It's $4,260 for 300 hours. So obviously that's not a lot of money, but again, they were saying that they have not had a problem getting people. And then, you know, with the possibility of getting the education award, but also just having an opportunity, you know, like for a lot of people who do things as a volunteer, you know, for the intrinsic reward that they get from doing it, the small amount of money, the flexibility, that kind of thing. So.
Okay, well that helps to have those numbers, though.
Yeah, and I mean, it goes up to full time of 1,700 hours at 24,200. But you know, I was assuming people would be, you know, looking more on the low end, but you know, there's that full range.
This is Glenda. I've also got experience with the AmeriCorps. I was at AmeriCorps through the Boomers Leading Change in Health program here in Denver prior to coming to the center.
Yeah.
Yes, and so we currently have AmeriCorps people here on our staff. Now, what AmeriCorps with Boomers found was that trying to do full-time, because it is somewhat of a volunteer position, they decided to just go down to part-time because the people were not able to complete their commitment when it was a full-time position. I was full-time, and it was very difficult to complete those hours. But as part-time, they're having a lot more success with that. And just as you said, some of our AmeriCorps that we have on staff, they are doing the DSM classes. They were certified as facilitators and with the criteria. And because, you know, we just have them doing other program support, so maybe perhaps they're volunteer coordinating or just whatever other things that we need here that the center needs. And exactly what you said as far as the matching funds, and it does help with your finances because you're not having to pay that full part-time person.
Okay, that's good to know. Well,
I wonder if this is when we also need to get some more information on maybe polling people, see who might be interested, and get some information from the state, more details on the grant, and maybe share that with everyone.
Well, yeah, it'd be good to have some idea of some people who might be interested. And then, so maybe if you can include in the minutes, or I could send something out to people as well to say, you know, contact me if you're interested in this at whatever level, whether it's a local entity that says, hey, we could use somebody, we'd be interested in participating that way, or one of the organizations that might be interested in orchestrating the grant and overseeing it, to let me know that too. And then maybe I've got all the, I can send out also like the specifications for last year that would give people more details. But we would need to kind of start.
So you're thinking the grant would need to come from one of the collaborative members rather than from your office?
Probably. It seems like that's how, I mean, it's not that we couldn't do it at the state level, but in terms of paying people and that kind of thing, I don't know that we could do that. I think it'd probably be more appropriate and easier to run from a nonprofit, or I don't know about county entities. I think counties would be eligible just like the state is eligible, but so I wouldn't, you know, eliminate that possibility. But I'm not thinking right now that we at the state level would be running the grant.
Okay.
So yeah,
well, we have about a half. I'm sorry?
So we can keep that in mind, and if people can let me know if they're interested, that would be great. And I know let me just mention the business sustainability consultant, and we can move on. And I know this has taken a lot of the call, but I'm I'm hoping that it's useful information because I wanted to pass on all of this and get your input on things, which you all are great at giving input and asking good questions. On the business sustainability consultant, I am planning to send out the solicitation on Monday. I'm waiting for some input from various people on that, and I'm working on a short timeline to try to get them on board and to have our in-person meeting that we've talked about in August. What I'd like to do is try to do that as late in August as possible, just because we have the contracting process and approval process here that we need to go through. So I'm going to be sending out a poll asking for the best dates and times for that meeting, and I'm hoping that that'll be okay to do that, so that we can find a time in late August rather than at the beginning of August. Lindsay, if that would be, we did talk about needing to open that time up, and that would make it most likely that we could have the person on board by then. So would that be okay if we
I think it's
try to do that late in August?
Yeah, I think sending the poll to figure out what's a good time for the in-person meeting is really critical, because it's not so much. I mean, I'm one person, but I think of what we know about how hard it is to even schedule a phone meeting. So when we talk about an in-person meeting and vacation schedules and back-to-school schedules, so I think the sooner the poll can come out to see when people are available, the better.
I can do that right away.
Cool.
We have to obviously get the person has to be available, but the prospective applicants that I've talked to so far said they would be available during that last week or week and a half of August. So yeah, I mean, we're not going to get everybody, just like even if you plan something 6 months in advance, you don't get everybody, but we will try to get as many people as we can, and I can send that out probably today.
Great.
Okay, thank you.
You're welcome. Well, anybody else have anything before I move on with the agenda? We have about 27 minutes left. Okay, so monthly update on our centralized referral system. This is a new monthly update of what's happening with referrals through RICO and other sources. And I promised you a little bit more detail in this month. So I wanted to let you know that we have 2 leaders who just trained in the chronic disease self-management program who were referred through a phone call with Connie. And we got them trained. They had called the state unit interested in doing the arthritis version of the self-management program, which nobody is offering right now, but we were able to talk with them about the chronic disease program, and ended up, both of them have trained now and are going to be doing classes in clinics specifically geared toward treating folks with arthritis and arthritis-related conditions like lupus. And so we're real excited about that. We've also got 9 referrals that are still in progress. We have a total of 15 referring providers so far. And I'll come back to the DRCOG update. One of the things that would be really helpful to us is we know that we have shared some of the referrals that we've received with Boulder AAA, and I don't believe Melissa's on the call today, with UC North, and I know what happened with that referral, with Colorado Neurologic Institute and also Kaiser Permanente. And we know who has finished those classes or started those classes. But if we send you a referral, or just this person is in your neighborhood and interested in classes, it would be really helpful to hear back as well how that works. So, for example, I know that we've had 2 that we referred to University of Colorado North, one who did not go into classes yet because they're looking for a chronic pain class, but in Metro Denver, and the other one did complete the chronic pain program in the fall. So we want to be able to add those kinds of things into the statistics we're keeping. So these are just a little bit of a an overview of where we're at. Referrals total per agency right now, A.F. Williams is 33, and although A.F. Williams is not a RICO in and of itself, it is a part of Colorado Access, and since that's how we got connected in classes running with A.F. Williams, we're counting it in this whole process. So we've had one referral from Physician Health Partners, 33 from A.F. Williams, and 29 from Colorado Access. And then in terms of attendees, we've had 19 from Colorado Access, 13 so far with A.F. Williams, and the person who was referred by Physician Health Partners did not start classes. And then we have the completers. So of the A.F. Williams, 13 that started, 8 completed. Of the Colorado Access folks, 19 that started, 17 completed. So we are making strides, but I think part of it depends on you. We were talking earlier about incentives. The Colorado Access program had a great incentive project, but it was very much grant dependent, and the grant is now ended. So things are at a standstill there, as opposed to A.F. Williams, which has not only been very willing to have classes on site, but to work with us on referrals, but they're finding that it's a little bit trickier to get their folks into classes and able to get to classes consistently, and then you can see a little difference in the completer numbers as well. So that is the overview. I want to go back to our Dr. Cog presentation update. This was a great opportunity for us to talk about care transition with the folks at Denver Regional Council of Governments, which is the state's largest AAA. And Mary Pat or Connie, you want to say anything about how that presentation went?
Well, I'll let Mary Pat fill in some details as whatever she wants to say. I thought it went great, and evidenced by the fact that the leader of the director of the Area Agency on Aging asked COA to offer a class for their staff. And I don't know that that means their staff have a lot of disabilities or chronic health conditions, but they were, looking at, issues such as weight loss. And anyway, that was really impressive to me. She was there for the whole presentation, and we talked about not just care transitions, but all levels of the AAA in terms of just the information, people who are on the phone, directing people to resources, and the people who do coaching and case management. So we got a great turnout that was supported by Amy Polly, the person with the care transitions section who supported it and worked with their director and all that. Mary Pat did a great job of, I'm sorry, this is Lindsay. Or no, maybe, I'm sorry, we've done a few presentations later. I think it was Mary Pat talking about some of the testimonials and of people who've been in classes. Did you do that, Mary Pat, at Dr. Cog? Was that you or Lindsay? Whoops, did we lose Mary Pat? Whoops, did you lose me?
Nope.
Nope. Anyway, was that you, Lindsay, or Mary Pat?
That was probably Mary Pat. I think we tag teamed it a little bit. But
yeah, you both did a great job. And anyway, I just always think that that's really gets people's attention when you hear a story about somebody and the impact that it has. It drives the whole point home. So I thought it was great.
Great. Well, hopefully we'll get to do more of these in the next cycle. Just a little bit more information. Wanted to give you an idea where people are attending classes from the referrals that we have received. Right now it is primarily Denver city or area, 1 in Lakewood, 5 in Aurora, and that is just because that's where the RICOs were operating. I do know that Holly worked with them on trying to get some folks into classes that were up in Fort Lupton, Greeley area. We're not successful with that first go-round, but hopefully as we keep moving, that's what we'll have more success. So that's my overview for now. I wanted to thank those of you who sent classes And I know Center for African American Health, thank you very much. We're glad to have those classes listed on selfmanagementcolorado.org, because that's where we go when we are trying to make referrals. So since we are hoping to soon start seeing more from Dr. Cog and the Care Transitions folks, and also more from the presentations in Grand Junction with Hilltop, hopefully we'll have a little bit broader numbers to share as we move forward. So that is my total update on that. I want to move on to Flora to see if there's anything new and exciting you want to share with us, Flora, about the data, data submission, any updates on anything related to that.
Thanks, Lindsay. Actually, we don't have anything new nor exciting about data submission. It's all the same. Lori's continue to get data and workshop packets from you all, and she's being able to catch up with some older data, so that's good. Thanks for sending that in. And otherwise, just business as usual.
Great. Okay.
Does anybody have questions for me? Well, I'll be here if you come up with any questions.
Okay. Thank you, Flora and Becky. So just a couple of training updates. I know SEGAHET has the CDSMP, DSMP training in Pueblo, August 25th through 29th. And Eve, are you still on? Can you tell us if it's what the cost is for that?
You know,
or if there's a cost?
There is generally not a cost for our classes. Crystal generally deals with that, and so I'm kind of caught here, not really sure about whether I'm giving you accurate information. So at this point, I'm going to have to, I think I'm going to say, I'm not going to commit to that.
Okay, so we'll just have people call if they have questions or if they're interested. And then I know that Sue Connery, who is not on the call today from Hilltop, is putting together a leader training in CDSMP in Grand Junction, July 29th through August 1st. And the last I heard, she is still looking for one master trainer. She has one committed. She's having some trouble with the dates. And so if there are any master trainers within your world that might be interested in going to Grand Junction for that period of time, now would be the time to let Sue know. Connie, have you heard any more from her on that?
I haven't. You know,
okay.
I was just thinking, I don't know if we could get somebody to come in from Utah. I don't know if they have a program or there's anybody in the eastern part of Utah that could cross state lines, but it seems like we would have more people to pull from. So, but I don't know. I know. Well, I don't know anything more.
Okay. Well, I'm hoping. I know that we've sent some other names over, so I'm hoping one of those will work. But if any of you know anyone that might be interested in making the trip, it's a beautiful time to be over there. That's for sure. So. And then
if I could I mention one thing real quick on that?
Sure,
Lindsay. If you have people who are, the way this would work in terms of, we have some grant funding identified for that. If it's someone who is a private, contractor, the money would go to pay them, and then Sue will work out housing and travel expenses. And the same thing could be done for somebody who works for an agency, but the money would go to the agency. I mean, if they do this as part of their job, then they could lead the class, and then the funding would go to the agency, for example, a AAA or whatever. But so we do have options for supporting the funding of those individuals, and basically the trip would be paid for, and their time would be. They would get a contracting. They would get paid for their time, or the agency would get paid. In case that makes a difference.
Hi, this is Monica. I would still like to be considered for stuff like this, but this particular one, I'm just going to be out of town, so
Oh, darn.
I already have prior.
Okay.
I know. I wanted to go so bad, but it was on the first, and I do have a prior commitment.
Oh,
so,
okay. Yeah, thanks for your interest in that, Monica.
Yes, definitely. And then I do want to let everybody know I will put it on the website, but we will be having 2 diabetes classes, one here in Alamosa and one in Blanca, Fort Garland. To start, the Blanca, Fort Garland one will start on the 23rd of July and go through the 27th of August. And then here in Alamosa, we'll have a diabetes class to start the 24th of July and to go through the 28th of August.
And those are not the trainings. Those are the actual classes you're doing.
These are the classes.
Okay, great. And I have you down that you're doing a leader training, sometime date to be determined. Do you know yet when that's going to be?
I don't.
Okay.
You know, we're just getting going on those new leaders that were trained now in May.
Sure.
And
I just wanted to
so,
make sure we had it up if you knew it. So.
Okay,
cool.
I don't.
Okay. Well, congratulations on the 2 diabetes classes getting going. That's very exciting.
Thank you. Thanks, Lindsay. And then I do have one more question. We have never, here in the Valley, we've never done a session 0 and would like to do one. The only thing is I'm not really sure how to get that going. If anybody's having one, I would like to maybe, if I could pop in and attend one so I could see kind of how it's put together or what happens through that. So I didn't know if anybody knew of something coming up or if someone could keep me in mind as far as when they've got something planned as far as the session 0.
Well, I think that we can definitely keep you in mind. I'm not sure how many of our folks are doing them now. Secahek, are you doing any? Because you're probably the closest to Monica.
We have not done one.
Okay.
Here at Secahek, we have not done one.
Well, I tell you what, Monica, we'll all keep you in mind if we're going to.
Okay.
Lindsay, this is Holly.
Yeah.
When we first started doing classes, we did a couple of session 0s, and we just kind of invited them in and did like a little PowerPoint that kind of went over some of it was more of like the overview and detail. And then we also did the lemon exercise with them just so they could get, a little taste of what some of the hands-on parts of the activities were. We don't do session 0s anymore, but the ones that we did do, they were successful. And, I would just keep it short. It's a good time for them to register. They could even fill out the little demographic form that we have now. And, we had snacks for them, and it was a good opportunity for them to ask questions. And you could even do like a mini brainstorm where you have them, what are some of the things you expect to get out of the class, and so they get a taste of that.
Okay, thank you.
Mm-hmm.
And then do you just advertise it as, do you advertise that, I'm assuming?
I think we advertised it as an informational session. It was like 4 or 5 years ago that we did them, so
oh, okay.
It's hard to remember exactly how we did it, but it was just kind of, come and learn about the workshop and register.
Okay, thank you.
And then, of course, we also had people that came to the classes that never went to the session 0 too. So, I mean, it wasn't 100% that those people did it, but.
Okay, great.
And then also in regards to the training in Grand Junction, I had some classes come up that interfere with those dates. I could probably commit to, I know it's not ideal particularly for the leaders that are getting trained, but I could probably do 2 of the 4 days if there was another master trainer that could help out with that at that time.
That might,
you know,
Holly,
if anybody's out there.
Yeah. If I were you, I would suggest sending an email to Sue just to offer it to her.
Yeah, I just had the opportunity to talk to Eva about it yesterday, so I haven't even had a chance to email Sue. So
great.
I'm just putting that out on the call for other master trainers that if, you know, maybe they can't do the full 4 days, I could maybe do 2 if they did 2 or something. It's not ideal, of course, but at least that would get covered.
And I know she does have one person for the full 4 days, and so that, you know, that's good. That's good. Well, since we're talking trainings, are there any other, so we know there's another one coming up in Alamosa at some point. We're going to be doing a chronic pain cross-training at some point this fall. I do not know dates yet. Is there anybody else that has training scheduled?
Lindsay, this is Ellen in Fort Collins, and Susan is thinking about doing one the end of August for a group of people here, but we haven't really confirmed anything yet.
Oh, great. Okay, thanks, Ellen. Next up is, I know that Connie had some information she wanted to share with us about marketing. I just want to flip ahead. I'm going to come back to this, Connie, but since we're kind of short on time, I'm going to just wanted to make sure that I mentioned to everybody, because we may lose some people, as we oftentimes do when we're heading down to the bottom of the hour. We do have, our next meeting is set for Friday, August 1st, and then Connie's going to also get us out the doodle or some sort of meeting thing to find out, so we can figure out when we're going to do our in-person meeting. But we'll keep this Friday, August 1st one as our regular monthly meeting. And we're going to go back to the marketing spotlight, but is there any additional information or anything else that anybody wants to add before I turn it back over to Connie? Okay then, Connie, I know that this is the information that you had put together, and I'm going to let you explain it. It's on a couple of slides, so it's divided up for professionals and, as you can see, for community audiences. So I will let you explain it to everybody.
Thank you. For marketing purposes and outreach and all that, it's helpful to sort of identify in advance what the most important messages are, and sort of like, you know, make sure that those messages are getting conveyed consistently. And I did not have a set of those for the work that I do and for some of the presentations we've been doing. So I wanted to draft those and ask for your input. So I have the bulleted list here. This is kind of, these get tailored all the time based on the method of outreach. You know, if it's a presentation, you obviously typically have more time to cover more content. If it's a brochure, you have less. If it's an ad, it's even less. So I always look for ways to get out the most important messages in the, you know, format that is in the format that we have, and also tailor it somewhat to the audience if that's doable. But I developed these, and we've been covering most of this in the presentations we've been doing. And then for the list on the next page, the community audiences, and prospective clients, it's I leave out a lot of the stuff that would be more bureaucratic. They don't care about, you know, the collaborative or grant, or, you know, how many classes are being offered in another part of the state. They want, you know, obviously to know what's going on in their area. So I wanted to ask for your input, though, on those, and maybe we can do that via email, and then I'll just ask you to send me comments on these, areas you think I might have missed, any questions, you know, that sort of thing. So basically, you want that kind of input, and it's, I think that'll work best via email after the meeting. Are there any questions about what I'm asking for here?
So is the hope that then we'll all be working from a similar sort of set of, oops, I went back wrong way, that we'll all work from a similar set of key messages? Or?
Well, yeah, I mean, I don't think this is really going to be changing anything anybody's doing. I think it reflects a lot of what's happening already. I need it just to make sure that I'm covering what's most important. But yeah, I mean, I think this can be a tool for other people, you know, that, you know, you all have been doing presentations and probably ads and news releases and things like that. But, you know, it's a time to kind of step back and say, you know, are we covering what's most important? You know, are we leaving anything out? That kind of thing. So I'm not issuing a statewide edict to cover all these, but it's a tool for use, you know, at the state level, as well as a resource that can be used by other folks.
Okay, sounds good. Thank you. Thanks for the clarification. I just wasn't real sure what kind of input. Are you looking for bullet points for underneath these topics? Or are you looking for? I'm not sure. I guess I'm not clear what kind of information we can help you with.
You don't need to submit, or you can if you want to submit specific wording, but this was more a step back, like what are the topics, and then what comes next is the actual verbiage that would be used. But it's basically to say, you know, are these topics right? Are there any that are missing? Is there more of an emphasis on one that you think we ought to focus on? But anyone who would like to submit actual verbiage is more than welcome to do that. That obviously gets changed depending on the specific format for the message, whether it's a presentation or a brochure or a news release or whatever. But this is the content of the messages, or the basic topics that would be covered. So that's primarily what I'm looking for.
Great. I got it. Okay, thank you. So what do you all think? Does anybody, to me that looks real comprehensive. I don't know if anybody else has had a chance to really look at it yet, but what do you all think?
Well, I think that this is just good reminders, I think, of what we need to be putting in our pieces. You know, like I think a quote from a participant would be powerful, those, you know, especially in communities that are somewhat small. So I think it's just a really good reminder. So I can appreciate all these pieces that you're including here.
And we can, you know, we're about out of time, so I appreciate that. Was that Eve?
Yes.
Okay, thank you. We can open it up for comment after the meeting as well, because it's a lot to just sort of look at and comment on in a couple minutes. So.
Sure. Anyone else have anything they want to add? Go back to this one. Okay, anything else you wanted to add, Con?
Nope, that's it for me. Thank you.
Okay, great. Well, it is now 10:29. We did very well. And so what we'll do is just to re-highlight things, we'll be touching base on a couple of things during the month, in particular the in-person meeting around sustainability, the possibility of talking more about prison-related programs, the possibilities of talking more about AmeriCorps programs, and we will be in touch regarding the prospective participant as well as the professional audience key messages and key points. And I agree. I think it's just a really good reminder. So it's great for everybody to take a look at that. And anything else that I have forgotten that we need to make sure we don't forget?
I don't know if I mentioned that if anybody has any suggestions of people or organizations that might be appropriate to submit a proposal or request a proposal for the consulting contract, to let me know by Monday. I think I had it on bullet point, but I might have skipped over that.
Okay. So that's by Monday, July 7th.
Yes.
Okay, great. Well, everyone, as always, this will be posted on the website, and if there's anything you need, or just send us an email. And thank you again for the class listings. That really makes a difference when we're talking with folks. So have a wonderful July 4th. And for those of us on vacation or soon to be on vacation, happy vacation. And we will talk next month, if not before. Thank you all.
Thank you much.
Thank you.
Bye. Thank you.